Good morning and welcome back to my channel. My name is Patty Adams and I'm the CEO of Scars of the Past Ministry, which is a nonprofit organization that supports sexual assault survivors using a holistic approach. April is Sexual Assault Awareness Month. And this April 2024, we will be working around the theme called Building Connected Communities that was developed by the National Sexual Violence Resource Center. It talks about what we need to do as a community to support victims as well as survivors within the local Beaumont area and the surrounding areas. Today with me, I have a very, very special guest. Her name is Miss Rachel Thomas. She is a forensic nurse examiner and a community educator. She works with Christus Health of St. Elizabeth. Please help me at this point to welcome Miss Rachel Thomas. Hi, Miss Rachel. Thank you so much for joining me. How are you doing today?
Very well. How are you today, Miss Patty?
I'm doing pretty good. I know how busy our medical professionals are, and so a very hearty thank you for joining us. I do recognize that. And let me start by saying thank you all for your service, especially our forensic nurse examiners and our sexual assault nurse examiners. You all have a very tough position. So we're going to start the interview off by you just telling me a little bit about what a sexual assault nurse examiner or a forensic nurse examiner is, and then how long you've been in that position.
Can do. They are essentially the same thing, sexual assault nurse examiner and forensic nurse examiner. We both provide care for patients who have experienced sexual assault. We changed our name from sexual assault nurse examiner to forensic nurse examiner because we realized that there are more patients than just those that have experienced sexual assault that can benefit from our care that we provide. So we've kind of expanded to take care of persons who have experienced any type of trauma. Or crime of violence. And that varies between facilities, and different programs have different capabilities. But for our program here, we're able to care for patients who have experienced violence.
Thank you very much. And since I'm pretty much ignorant as to what you do, I'm probably going to ask some questions that you probably get asked all the time, but for the sake of our viewing audience, I want them to know as well. What type of background or training do you have to have? In other words, do you have to be like an LVN or RN first? What type of certifications do you have to be a forensic nurse examiner?
So in Texas, the Office of the Attorney General has some very broad requirements. You have to be an RN, licensed in the state of Texas, and you have to have 2 years of training prior to training to become a sexual assault nurse. So you can't just be a new grad and transition into this position. They want someone who's had 2 years to kind of find their feet and bearings before we add another layer of complexity. And so from there, the Attorney General requires that there's a 40-hour didactic course for adults. So if you're going to care just for adults, you just take that 40-hour course. But if you're going to care for adolescents and pediatrics, you take an additional 40-hour course. Okay. And then they require that you provide documentation that you've taken care of a pediatric population and a well exam for so many hours. And then you have to provide documentation that you've provided at least 10 speculum insertions on well women before we start trying to provide speculum insertions on someone who's experienced violence. Yeah. And you have to observe courtroom testimony. That is an aspect of forensic nursing. And so we kind of want people going through the training to get an idea of what that looks like.
Thank you.
Then you have to have so many adult preceptored exams with someone watching you and helping you kind of guide you through the process so that you're able to provide care for an adult who's experienced sexual violence. And then if you're going to provide care for adolescents and pediatrics, you have to do additional exams on that population that's being precepted by someone who's already providing those exams. So we're not just caring for persons and we haven't had the training and we haven't been guided on ways that might be better to take care of our patients. It is an in-depth process, and the Attorney General actually gives 2 years from the time you start your training to let you obtain all of those things from a reputable, respected entity. So you're not just out trying to find anyone who can hold a speculum to teach you. So there is that opportunity to learn from someone who has the proper training, and you can utilize that.
That is
And that's
very
just for
good.
the Attorney General.
Right. I know. It's just like, whoo, that's a lot. But I appreciate you being so extensive about it, because I didn't realize that was such an extensive line of training. But it also makes me feel very good that if I ever needed to have that done or have to send someone to have it done, I would say, hey, check this out. Those ladies and those gentlemen, they know exactly what they are doing. And so thank you for that. That helps me a whole lot. And I will tell you that I am a sexual assault survivor. I was unfortunately assaulted 4 times in my life. And I know some people barely get through one. And this was earlier on in my life. So the last assault was in my late 20s, but I remember it like it was yesterday. And I didn't even know that these type of things existed. You know, it probably could have had some of the people that assaulted me could have potentially had them behind bars. And so that's one of the reasons I really wanted to get this out there in the public so that people would know. Now, I know that one of the things, now that I've done a lot of research and studying on it, that you're told to do is that if you're assaulted, or if you're raped, or if there's sexual violence, do not take a shower. Don't wash your clothes. Don't take a shower. Is that media, or are those type of things really helpful?
Yes and no. So best case scenario is if someone is assaulted, they immediately report to a place where they're able to have their exam. That's not best practice for some people. Some people have to get their minds in a good space before they can go have someone else touch their body. So not all is lost. If you are assaulted and you take a shower, not all is lost. If you take a bath, not all is lost. If you urinate or have a bowel movement and you wipe your body, that's okay. What we've learned, good and bad news, not every sexual assault exam will evolve into a court case and a conviction. That helps us because as a forensic nurse, my singular vision isn't on collecting these magical swabs that are going to put someone in jail. My focus is taking care of my patient.
Absolutely.
And beginning that healing process. So regardless if you've had a bath or showered or douched, or you've had something to eat or drink and you used the restroom and you've changed your clothes and you've washed your laundry and you vomited and you've taken medication and you've had 3 naps and you had to travel 600 miles to get to me, I'm still going to take care of you the same. And we're still going to collect the same specimens. And God willing, and the creek doesn't rise and everything falls into alignment, some point in the future it will end and go into court in a conviction.
Thank you.
Even if it doesn't, we are able to care for you medically. We are able to care for you physically and mentally and socially. And we're able to assess if you're going to go home to a safe place. Because we definitely don't want you going home to someone who's just assaulted you. Right?
Right.
We're able to connect you with, say, our advocates who can maybe get a restraining order. We're able to connect you with law enforcement who can help make whoever's in your home get out of your house. We can help treat you. So if there's a concern that you've been exposed to a sexually transmitted infection or an unwanted pregnancy, there are medications that we can provide you while you're at the hospital. So that's one less worrisome thing that you have to think about.
Yes, yes.
So that kit is important, but it is not the end all be all. And to be honest, if you came to me and said, hey, look, I was sexually assaulted and I want you to take care of me, but I don't want that box collected, I would do the same thing for you.
Okay.
And just not collect that one box. But I would still get your history. We would still address all of your medical needs. We would assess you for any injuries and how are we going to fix those. We would assess you for infections and how are we going to fix those. We would get you set up with advocacy, and we would make sure that you were at least on the road to healing before you're discharged home.
Thank you so much. And that really clears up some of the myths because, from the public standpoint, we hear so many different things. And even those type of things can cause great anxiety and make you not want to go through the process because you really don't know what the truth is. And I'm not picking on our media because I believe there's some very trained and very helpful media as well. I'm just saying that that's all that we have to rely on. And so I wanted to clear up some of those myths. Now, if I'm sexually assaulted today, let's just say that I do know all this information. Can I go to any hospital and get the exam done?
Any facility that has an emergency room is required by law to be able to collect that specimen kit,
Okay.
which means that any ER, there is hopefully at least one nurse there that's had 2 hours of training on how to collect that kit. So it's better than nothing,
Yes.
but it's not great.
Right, right.
So there are facilities that have entire teams of forensic nurses that can care for you. In our Beaumont area, the hospital is St. Elizabeth Hospital that has that team. There aren't any other hospitals in Jefferson County, Orange County, Liberty County, Newton County, Jasper County, Hardin, nowhere in our area other than this hospital is there a hospital that can provide that for you and provide, like if you need a CAT scan because you've been strangled, we're able to do that. If we need x-rays of something because we feel like there may be a fracture, we're able to do all of that inclusive.
So I work with sexual assault survivors.
Mm-hmm.
At one point was probably a victim and now they're a survivor. And so if they came to me or came through our organization and needed to get the help, the place that I'd want to direct them to is to St. Elizabeth. And I take it that you have on-call nurses so that, the wait wouldn't be, say 3 hours once they get there. They would easily be taken to an exam room and not have to sit out there maybe with the rest of the public.
In a perfect world, yes, there are nurses on call.
I know I keep thinking about those perfect worlds. I'm so sorry.
So,
Forgive me.
yes, there's always a nurse on call. However, if the nurse on call is already in the hospital providing care for a patient, then there may be a delay. But that being said, we attempt to have our patients at least have a waiting space that's private. Excuse me. So you're not out in the general waiting area. So even if there is a potential wait time, we try to find at least a private waiting area for you and your family to wait. So, you're not exposed to the cold coughs and flus when you're there just for being seen by the sexual assault nurse examiner. So there is at least a waiting area for you.
Thank you. Now, a while back during the month of April, which is Sexual Assault Awareness Month, I just happened to be watching an episode of Grey's Anatomy, and I don't know if you saw that or not, but they actually went through the whole process of rape kit. That was a young lady who had been assaulted. She came to the hospital, and they pretty much showed step by step what happened. And one of the things that I really appreciated is literally before they collected any type of specimen or evidence, and I may not be using the proper words, they asked her, "Is it okay?" And I found that to be very confident because you already have been assaulted, so you may not want to be, touched. And okay, let me get under your nails and let me pull some of your hair and do all this stuff. For in your experience, is the process as gentle as possible to try to make that person feel at ease?
From my experience and knowing the team that I work with,
Yes.
it is much more mindful.
Okay.
We don't, when we provide care for a patient, we don't just get a consent at the beginning of the exam, and that's just a blanket consent that we're really able to do whatever we want to our patient because they said yes. First of all, we get an enthusiastic yes,
Okay.
which is different than well, I guess.
Yes. Yes.
So we need an
Very
absolute
important.
move forward, right? And I don't want there to be a feeling of pressure or of coercion. So an enthusiastic, absolute, yes, let's do this before we move forward. And it's not a me versus my patient, right? It's my patient and I are providing this care for my patient together as a team. And so when we change that mentality that it's not the nurse doing something to you, but we together are performing this exam, that's kind of that shift that makes the healing process begin. Because if you're coming to see us, potentially something's already happened to you. We want to do things with you. And that makes a huge difference.
And that makes a lot of sense. Thank you for that. So I'm going to go just a little bit deeper. What all is done for a patient when they come in? What type of specimens or evidence is actually collected? I know, like, maybe under the fingernails and maybe up strand of the hair, but can you tell me maybe just a little bit more of maybe how long the procedure takes? Just give me a little more info.
Yes and no.
Okay. Okay.
Every exam is specific to that patient.
Okay.
And there is not a cookie cutter answer, and there's not a cookie cutter collection.
Okay.
So the way every exam begins is we're going to get consent, like we talked about. And then my patient has the opportunity to tell me why they're at the hospital uninterrupted and unadulterated. So I'm not going to get a pre-story from triage, and I'm not going to get a pre-storage story from the police. My patient's going to get a blank slate, and you get to tell me why you're there. And then based on what we talk about is how I take care of you. Just like if you come in and you say you're having abdominal pain, I'm not going to spend 3 hours checking your eyes.
Right, right. Makes sense. Yes.
So if you come in and you give me a very specific history of a certain type of contact, that's going to dictate how we take care of you. It's going to help me understand what are the possibilities of pregnancy. So if there was no contact that could produce a pregnancy, then we're not going to worry about pregnancy. But if we're going to worry about infections, that's going to be something else. So each patient is specific, and based on the history, it helps guide our exam. So for example, if you were to say that someone placed their hands around your neck and they place pressure, well, now I'm going to worry about strangulation, but also I'm going to worry, would that be a place that there was a transfer of their DNA to your body? And so that may be a space that we collect specimens from. And so there's not you don't do all of the specimens options for every patient, which is nice. So it's very specific. And the length of the exam really based on your patient. So if you come to see us and you don't have a body surface that is covered in injuries, then we're not going to have to spend 3 hours documenting each injury. So I tell my patients I'm here for as long as you need me. And then as soon as we're done, then I'll let you be discharged and I'll finish my paperwork after you leave. So exams can last 1 hour. And exams can last 7 hours. And it's really decided by the patient and what they can tolerate, because sometimes we just need a break, and what their history dictates.
Now, I've worked with, and thank you, with male survivors as well as female survivors. And this may be an odd question, but again, it's all for the sake of being able to educate our community. If I was to come in there, I definitely wouldn't want a male tech or male SANE nurse to touch me because I was assaulted by a male. The same holds true possibly for a male. He may not want a female to touch any of his body parts in order to collect this data. Do you all have male SANE or forensic nurse examiners?
In our area now, we don't.
Okay.
And I will challenge you to perhaps let's think about our mentality. In our mind, sitting here today, we can think, oh, if I was sexually assaulted by a man, I wouldn't want another man to touch me, which is fair. Except for perhaps having a male who is trained in the care of someone who's been sexually assaulted, who comes in with that compassionate, patient-centered approach, being your next interaction with a male, how could that help us reframe our perception of men? Yeah, we had a bad round, and that was terrible. But if your next interaction is with someone who helps begin your healing process, Could that perhaps help map our brain to a healthier view of men? Possibly. In the same way with women. If a man's been assaulted by a female, and and now in their mind they're like all women are bad, well, how can we disprove that false belief unless they're provided that healing approach by a female? And remember, no exam happens without the patient's consent.
Yes.
And I think having that groundwork for the patient's like, you mean I can say no? Absolutely. There's power in that. And when they're allowed to say no and nothing bad happens, and they're allowed to say no to this portion of the exam and the exam continues, oftentimes they're like, well, if it was really important, maybe we could go ahead and do whatever I said no to. But it's all about choices and allowing them to have the space to be comfortable saying no and nothing bad happens.
That just brings back so many memories. And so if you saw me smile, sometimes I smile and I laugh when things are very emotional to me. It kind of helps me to keep from crying. But even within my ministry, when I first got the vision, I will say, from God to create Scars of the Past ministry, it was totally to be able to help female victims. And that was it. And I kept hearing God tell me, no, you're going to help male victims too. And like, I'm going to argue with God, right? I'm saying, no, I'm not going to help men. It's men that did this to me. And God is like, yeah, you are going to help them. And so it was like this tug of war, knowing that God was going to win, by the way. Hence, I
Of
told you
course.
earlier that I do help men. But it was really a process mentally for me. And the only way that I was helped through that was God saying, but it wasn't those men that you're trying to help that did that to you. And just like you were hurt and you were assaulted and you had, guns pulled on you and knives and all these different things, they experienced the same type of trauma and they deserve the same type of care. That was life-changing for me personally, because I had made up in my mind that I will refuse to do that. And so just your passion as you're explaining these things to me would help me, regardless of what my sex or
Right.
gender was, to say, you know what? I think that Miss Rachel can really help me through this. And so thank you for that. I'm going to stop now
You're
on that
welcome.
because I don't want to break into tears, but
Yes, ma'am.
yeah, that's life changing. And so it's, even for me, it's I have to ask the tough questions because ultimately my goal is to help someone who may be
Right.
experiencing this to know what to do. So we're going to keep moving forward. I won't keep you too much long. I do have just a few more things to ask. So you have your accreditations, or you have to have your certifications done. You go through all the training. How is the evidence then packaged, collected, and how long is it kept? Like, is it sent to the police department, or what happens after all the testing is done?
So there's a whole bunch of questions in that question.
Oh, okay.
All right. So we'll have a couple of scenarios here.
Okay.
Let's say you present to the facility and you've already contacted law enforcement to have your Sane exam and to have evidence collected. After your history, we'll collect the specimens according to your history, and then they're packaged after you've long gone home. And we seal those and we have a chain of custody of those. Law enforcement has 7 days to pick them up from our facility before the Attorney General starts hounding them, saying, hey, don't forget you've got a kit here. And so once they pick them up, then they take it to their evidence collection storage space. And then every police department has their own mailing schedule, but eventually it's sent to the crime lab for testing. So we do the specimen collection, but we do zero testing of those specimens in-house. It goes to law enforcement, then it goes to the crime lab. And then crime lab has the opportunity to test that, and then they send all of those results back to the police department. So we don't even know if what we did actually collected foreign DNA or not, for sometimes ever. And so whenever you're at the facility, we provide you with almost like a tracking number like Amazon. So you're able to log on and see where that kid is at in the process. It won't give you results, but you can at least see if it's been returned back to law enforcement, and then you can contact your detective to find out what was in the kit.
Oh, no, I didn't know that. Thank you.
So that's one scenario. The other scenario is you show up to the hospital, you've not contacted law enforcement, and you're older than 18 and you're less than 65. And you tell me, I want to have specimens collected, but I don't want to tell law enforcement yet. And that's absolutely your choice, and you can do that. So we do the same history, body surface assessment, specimen collection. There are some things that if you don't report to law enforcement that we just are not able to collect because there's no storage space. But we can collect your specimens and put it in the box. After we've done that, we then ship it off to the DPS warehouse. It is never tested. It never goes to the crime lab. Nothing ever happens to it. And you have 5 years to decide if you want to contact law enforcement or not. If in those 5 years you contact law enforcement, you give them your tracking number, they contact the DPS storage, who releases that kit to them, and then they have it processed. And then after 5 years, if you've not contacted law enforcement, then all of those specimens that we diligently collected together are incinerated and they are gone forever.
Yes.
So there is a time limit, but there's also a storage limit. And so that they've met that 5-year line is what they feel like is a fair time for divorces to be finalized, or you to have your discharge from the military, or any of those things that may have keep you from contacting law enforcement. They should have been able to be kind of resolved in those 5 years so that you're able to get it processed.
So working with children, I know have to be totally different from working with adults. Tell me what your process is, and perhaps some of the other SANE nurses' process is when you're having to do collections or administer a rape kit to, say, an 8-year-old. How do you
They're all the
help?
same.
So children don't freak out like an adult would freak out? They wouldn't?
Absolutely not.
Okay.
Of all the exams I've ever done, I've had 2 instances where a little person has just been very upset and very crying.
Okay.
One of them was because she was diabetic and her blood sugar was like 600.
Oh.
So that, yeah, she was mad, but
yeah,
it had to do
it was a
with blood
different
sugar.
reason.
It wasn't
Oh my
me.
goodness,
Right?
yes.
And then the other one is just the families had thought they were doing the right thing, and so they'd gone to their pediatrician, and the pediatrician took a look.
Oh.
And then they'd gone somewhere else, and they
took a look. Yeah.
And then they went somewhere else and they took a look, and then they tried to get urine. So by the time the kiddo got to me, we weren't taking a look.
Right, exactly. Oh, bless your heart.
We still get consent. Of course, if you're less than 18, we have to have a guardian sign consent. But we still get consent from our patient. And we still get that enthusiastic consent.
Yes.
And so then once I get the basic information, the family's left in the waiting area, and my patient and I go to the exam room. And I ask my 8-year-old the same question. So why did you come to the hospital today? And we base our exam off our 8-year-old history. We do our specimen collection the same. We still have that conversation. We still talk about what I want to do, the why I want to do it, the how I'd like to do it, and would you like to do it? Because sometimes that's the best option. I'm really not interested in someone else touching me. But if the option is that you tell me how to do it, and then I can do the specimen collection, that's 100% okay. And so we do have that conversation as well. And that's pretty much how everyone is taught to do our exams. And we really have great success with our patients, typically sharing with us information that maybe they've not even shared with parents or guardians or law enforcement.
So just to be clear, no parent would ever, or guardian would be allowed in the exam room with the child. Is that correct?
I don't say ever, because there's no nevers and there's no always.
Got you.
However, I will say, like if it's a little bitty person, a person who doesn't have the vocabulary skills, we'll have a parent. At any time, a patient says, "Hey, I'd like my mom in here," then mom is welcome. At any time, they say, I really need a support person, we're going to get a support person. But I will tell you, especially in the person's gosh, I don't know, 50 and younger, if we're going to have to talk about sexual things, doing that in front of your mom can create some challenges.
Yes.
Because if their mom is anything like my mom,
Yes.
she can give you that look.
That's correct.
That means you hush
You're
your
going to shut
mouth.
it up.
Hush it,
Yes.
right?
Yes.
Or let's say we're talking and I say something that my mom didn't know. Because children sometimes just disclose in pieces. And depending on how the parents react is how much more they're going to disclose. Mm-hmm. So I may have disclosed a little bit to my mom, mm-hmm. and my mom started crying and wailing, rocking back and forth and smoking 600 cigarettes. Well, in my mind, I hurt my mom because I said the words that hurt my mom. Mm-hmm. Mm-hmm. So I'm just not going to talk about it anymore. Yeah. So then you go back to the exam room where you've got this forensic nurse and we're talking about some things. And I remember something that I feel like is important and I've not told my mom. Well, the first thing I'm going to do is I'm going to look at my mom. And if my mom starts crying, I'm done. Shutting it down. Mm-hmm. Mm-hmm. So sometimes it's better to let mom sit outside and have a non-biased, non-partisan, non-emotional person be able to hear all these things, because some of these things are not easy to hear.
Oh, no.
So being able to keep your game face on, let's, especially these young people, tell these recounts of what's happened to them in a safe space with mom understanding whenever we're finished with the exam, we're going to give you the cliff notes. Mm-hmm. We're going to talk about, when we were in our history, we talked about this happening, and then we talked about this happening, and then we talked about this happening, and then there may have been some other stuff that may be new to you, and so these are some of the new things. But I've also had time to prep mom or guardian, like, keep your face together. We'll go get some toys in a minute so you can break down and you can get your tears out, but keep your game face on while your kiddo's watching. And so that leads us to having a better, more thorough exam. Mm-hmm. Mm-hmm. We're reinforcing to that child that we can talk about hard things and not cause mom and dad pain, right? Because really, they're so worried about mom and dad, they're not even worried about their own healing and their own treatment, right? So we want them to focus on them. And then we're going to talk to mom. And then we're going to provide resources for mom and guardian and the kids.
And I think that is so much, much better. My first assault was at 11 years of age. And I didn't tell my mom. I never told my mom until I was an adult, because my mom was being very physically abused by my dad. And I, even at 11 years old, didn't want to cause her any more pain. And so I could not even imagine having to go through a test such as this. As soon as I seen my mom facial expression changed, I can pretty much tell you I would have been done. I'd have been like, okay, I'm done. I might not have cried, screamed, hollered away, but I'd be like, okay, are we done now? Are we finished?
We're done.
Yeah, you want to be finished with it. And so thank you for that. Two more and I'm done. You've been so patient, and thank you. I probably could talk to you forever because it's so educational, but I do realize that you have a job to do. Testimony. So from time to time, you're called upon to testify. And anytime I'm going to interview someone, I always do a little research and find out, some information. Otherwise, what do you have to talk about? And I believe it was possibly in June of 2022 and then in August of 2022, you testified. You may have testified more, but these were open cases. I kind of worked as a paralegal for a little while, so I know how to get into some public record things.
You know how to find them, yeah.
That other people may not know. But one of them that was heartbreaking, I believe, was the one you did in August 22 with two young girls. And I don't want to give any personal information. I don't think the last name was given, only the first names. But I just want to know, how emotionally draining is it for you as a medical professional to know that a child went through that, and then even to testify on that child's behalf? Is that emotionally draining for you?
So it can be. We're not talking about puppies and lilies and making candies here. Mm-hmm. I find that it's really, it boils down to our framing, right? So in the way I view it and the way that helps me come and show up to work tomorrow, is, yeah, we talked about some bad things. However, those bad things aren't happening today. And we're taking that as a springboard on how to move forward, how to address the medical issues, how to address the psychological issues, how to begin that healing process. And so I wasn't just another cog in the wheel of assault.
Yes, yes.
And a lot of times our exams are that stop point. You know, everything bad happened in the best world before. Mm-hmm. But that the forensic exam is kind of like your, you know, when you had your last baby, was everything was before I had the baby or after I had the baby. Mm-hmm. So this is, everything happened before I had the forensic exam or after the forensic exam. And as long as I can view it as that's where we started a healing process. And that's where we were able to start the stopping of the assaults. Then I can show up to work tomorrow.
And court cases for those type of things can go from 2 days to 3 months. I'm just making a range.
So usually the entire court case is less than a week. Okay. You know, by the time you have all the witnesses for the prosecution and defense, they're not much more than a week. However, they can take 12 years to get to court.
That's what I was concerned about, and especially with COVID, I heard that was such a huge backlog, not just with sexual assault cases, but just with cases in general, even murder cases, because it was so backlogged because of COVID. And so do you kind of still see that as a backlog issue now, even with sexual assault cases?
There's still a backlog, and there's probably always going to be a time frame, right? So we're not CSI Miami, so we don't get the result in the 60 minutes.
Right.
So that's why we try not to focus on, you know, I'm not an extension of law enforcement. I'm not an extension to the investigation. We provide medical care, and we're already assessing these areas, and we can be highly trained on how to assess these areas. And so while we're there, we can help collect specimens. But if it doesn't go to court, I still would have done the same thing. And if it goes to court 9 years later, we still have our patient's words, word for word, in their 8-year-old voice. Because in 8 years, you're going to have a 16-year-old young lady testifying. Mm-hmm. And sometimes it's difficult for law enforcement or for the juries to see that 16-year-old as that 8-year-old. Okay. And so having that history in their words kind of helps bring it back to, you know, that wasn't this young lady then, mm-hmm. It was a small person.
It was a small child at the time.
Right.
Yes. Okay, one more, and this one's a whole lot lighthearted than what I've been asking you.
Come on, I'm ready for it.
I was checking out Facebook, and I saw where in 2022 also where the Sane nurses was the recipient of the Christus Health Award. And, you know, I see doctors awarded a lot of times and nurses who are not specifically trained for this. But just to see that there was Sane nurses who received that award, I was like, yes, someone knows that sexual assault survivors exist and they're doing something about it. It gave me great joy to know that you all were recognized. I take it that you were part of that team at the time.
So you're talking about the Equity and Diversity Award, or which award? Because we've had a couple.
I don't remember. Actually, this was just on, it was on Facebook, and I think the CEO spoke before, and that's what it was called. It was called, let me get my notes here. It was to recognize Sane nurses is all that I said. It was a 22 recognition of the Sane nurses is the only way that I heard it described on Facebook. But look, it's even more good that you received a couple of them. That makes me even more joyful.
We really do have a very supportive administrative team, and they do recognize our contribution a lot. And so during Sexual Assault Awareness Month, you know, or during Forensic Nursing Month or Forensic Nursing Week, there are multiple, they just, you know, hey, we know you guys are there. We know you guys are putting the hands and feet on the ground for these patients. And so they are mindful and they do recognize us often. But it was nice to have the award corporate-wide.
This one was This one was actually maybe about 20 minutes, and I'm actually just looking at some of my notes now, and it had a lot of different people who spoke during that time. So it had like people from Harvest House that was speaking, from the Garth House. It had, I guess, the person who's over this actual Sane nurses there, coordinators. It was just like Kim Ducamp and just a Julie Prudhomme. I'm probably not pronouncing these people's name right, but it was really cool because as they talked about the award, they let each of the different, I guess, agencies that kind of work with you guys and that you all work with actually speak
Okay.
about the portion of what they specifically do, how you all assist each other. And so if that
Right.
helps anymore to know which Pacific award it was, but and I will get back with you on that. But I was just happy to see that you all were recognized for your hard work, because I have to say myself, I can feel your passion for it. And I think that people do things well when they do things that they're passionate about. I always
Right.
tell people, if you don't like what you're doing, no matter what it is, stop doing it, because you
Yes.
create an injustice to the next person.
Right.
People are going to know that you hate what you do, and that's what's going to come across. And so if I had a child that needed to get a test, or an adult that needed to get a test, whether it was sexual assault or domestic violence or whatever, I can tell you firsthand, you'd be the person I'd want to care for them,
Thank you. Thank
because
you.
you're
I
you're
will say
very,
that.
go ahead.
Thank you. I will say that that the passion is noticed in all of our forensic nurses on our team, and it's really funny that the nurse that needs to be on call will be on call for that patient that needs that nurse.
Yes.
So,
Yes.
and we find that because there's some nurses who relate really easily with one patient that just another nurse would not be able to. And so it happens consistently that the right nurse is on call at the right time for the right patient. So
God's
just
got it
know that,
on time. God's
well,
got it all
that's
worked out
it.
for us,
That's
doesn't
it.
he?
Right.
He has it all
Regardless
worked.
of what you think, you're going to be there when they need you. So
That's
that's how it
awesome.
happens.
Well, I will again say thank you so much for your time. Thank you for educating me, because a lot of these things I didn't know, which is why I asked. But thank you for your patience with answering them. I never felt like I was so rushed or like, oh my gosh, when is this going to be over with?
Not at
You
all.
are absolutely amazing, and I thank you. And stay around and chat with me for a little while. I like just,
Will
yeah,
do.
it won't be long, just for a little bit,
No
okay?
problem at all. Yes,
Thank
ma'am.
you, Miss Rachel.